Okay, so we will discuss about the Etomidate now. Okay, Etomidate is an intravenous anesthetic agent. Okay, Etomidate is an intravenous anesthetic agent used for the induction associated with rapid recovery without a hangover effect. Okay, it's used for it's a intravenous anesthetic agent for the induction associated with rapid recovery without hangover effect. Okay, so Etomidate suppresses adrenocortical function. Okay, it suppresses the adrenocortical function, particularly during the continuous administration. Okay, it suppresses the adrenocortical function, particularly during the continuous administration, and it should not be used for maintenance of anesthesia. Okay, Etomidate suppresses the adrenocortical function, particularly during the continuous administration. Okay, during the continuous administration, it should not be used for maintenance or maintenance of anesthesia. Okay, it should be used with caution in patients with underlying adrenal insufficiency, for example, those with sepsis. Okay, so what we have learned here, so that the Etomidate is an intravenous anesthetic agent for use of induction and is associated with rapid recovery without a hangover. Etomidate suppresses the adrenocortical function, particularly during the continuous administration. During when we give it administration, it causes the suppression of the adrenocortical function, and it should not be used as a maintenance of anesthesia. Okay, it should be used with caution in patients with the underlying adrenal insufficiency like sepsis. What is the pharmacokinetic? So uh, the induction dose for an adult is 0.3 milligram per kg. Okay, following injection, redistribution occur rapidly. Metabolism occurs via ester hydrolysis in both the plasma and the liver. Metabolites are excreted via urine and bile. 2% remain unchanged. Okay, so in pharmacokinetics, Etomidate induction dose for an adult is 0.3 milligram per kg. Following injection, redistribution occur rapidly, and metabolism occur via the uh, ester hydrolysis in both the plasma and the liver. Okay, and it's excreted in the urine and bile, and 2% remains unchanged. Okay, so what is the side effect of the Etomidate? So Etomidate causes less hypertension than the thiopental sodium and propofol during the induction. Okay, so Etomidate causes less hypertension than the propofol and the thiopental sodium. However, it is associated with a high incidence of extraneous muscle movement. Okay, it causes the extraneous muscle movement, which can be administered by an opioid analgesic or a short-acting benzodiazepine given prior to the induction. Okay, pain on injection is common, and there is a high rate of thrombophlebitis in the post-operative period. Okay, in the post-operative nausea, vomiting commonly occurs. Respiratory depression can also occur. Okay, so what we have seen that the Etomidate causes less hypertension than the thiopentosode or and the propofol. However, it is associated with a high incidence of the extraneous muscle movement, which can be minimized by the opioid analgesic or a short-acting benzodiazepine given prior to the induction. Then injection is common, and therefore pain on injection is common, and therefore a high rate of thrombophlebitis in the postoperative period, and the postoperative nausea and vomiting commonly occur. Respiratory depression can also occur. Okay, then Etomidate causes the least cardiovascular depression. Okay, of the intravenous induction agent. Okay, it causes least cardiovascular depression. Okay, with only a small reduction in the cardiac output and the blood pressure. Okay, small reduction in the cardiac output it causes, and the small amount of blood pressure decrease. In the past, etomidate was widely used induction anesthesia in the shocked elderly or cardiovascular unstable patient. However, more recently it has become less popular as a single induction dose block the normal stress induced increased in adrenal cortical production of 4 to 8 hours and up to 24 hours in elderly and patient debilitated patient. Okay, although no increase in the mortality has been identified following a single dose during the induction of anesthesia, the use of etomidate has declined due to perceived potential morbidity. Okay, so what we have learned that the etomidate causes the least cardiovascular depression uh, of the intravenous induction agent. Okay, with a small reduction in the cardiac output and in the blood pressure. In the past, etomidate was the widely used in shock, elderly, and the cardiovascularly unstable patient. However, more recently, it has become less popular as a single induction dose blocks the normal stress-induced increase in adrenal cortisol production for 4 to 8 hours. Blocks the normal stress-induced uh, increase in normal cortisol production for 4 to 8 hours and up to 24 hours in elderly. Okay, it causes the increase in the adrenal cortisol production. Okay, although no increase in mortality has been identified following a single dose during the induction of anesthesia. And the use of etomidate has declined due to perceived potential morbidity. Then flumazenil. So, flumazenil is a benzodiazepine antagonist. Okay, as we have seen earlier, flumazenil is used in the benzodiazepine toxicity. Okay, used for the reversal of the sedative effect of the benzodiazepine after the anesthesia sedation similar procedures. Okay, flumazenil is has a shorter half-life and duration of action than the diazepam midazolam, patient may become resedated. Okay, flumazenil has a shorter half-life than and the duration of action than the benzodiazepine and the midazolam. Okay, flumazenil should not be used in life-threatening conditions like raised intracranial pressure, status epilepticus. Okay, controlled by the benzodiazepine, as this would render further treatment, okay, if required, ineffective. Flumazenil should not be used in the life-threatening conditions like raised ICP and the status epilepticus, controlled by benzodiazepine. Okay, so this was the flumazenil. Flumazenil is a benzodiazepine antagonist, and it's used in the reversal of the sedative effect of the benzodiazepine in the after anesthesia, sedation, and other procedure. It has a shorter half-life than and duration of action than the diazepam and the midazolam. Okay, and fumazenil should not be used in the life-threatening condition like the raised ICP and the status epilepticus. Then the ketamine. So, ketamine has hypnotic, analgesic, and local anesthetic properties. Okay, ketamine has a hypnotic, analgesic, and the local anesthetic properties. Ketamine is an NMDA receptor antagonist, but it may be it may also have other actions. Ketamine produces so-called dissociative anesthesia, transient psychotic effect inducing, including alteration in mood state, then a floating sensation, then the vivid dream hallucination are common during the emergence from ketamine anesthesia. This usually resolve on full awakening. Benzodiazepine pre-medication, example with diazepam or midazolam, reduces this delirium, which also occurs less often in children and elderly. Okay, the onset of action is slower than other induction drug. Okay, the onset of action is slower than the other induction drug, 1 to 2 minutes of IV use, and the end point can be difficult to judge with the patient starting into the distance for short period of time. The duration of action of a single dose is approximately 5 to 10 minutes. Recovery is relatively slow. So what we have seen that ketamine has a hypotonic, analgesic, and local anesthetic properties. Ketamine is an NMDA receptor antagonist. Okay, but it may also have other actions. Ketamine produces so-called dissociative anesthesia, transient psychotic effect, including alteration in mood state. Okay, alteration in the mood state, then the floating sensation, vivid dreams, and the hallucination are common during the emergence from ketamine anesthesia. Uh, this usually resolves on full awakening, and benzodiazepine pre-medication with like diazepam and or midazolam reduces this delirium. Okay, the onset of action is slower than other induction drug, 1 to 2 minutes for IV use, and the end point can be difficult to judge with patients staring into the distance from for a short period of time. The duration of action of a single dose is approximately 5 to 10 minutes. Duration of action is 5 to 10 minutes, and the onset of action is occur in the 1 to 2 minute. Okay, recovery is relatively slow. So use of ketamine. So ketamine is a unique combination of cardiovascular effect. Ketamine has a unique combination of the cardiovascular effect. Okay, unlike other induction drugs, it has a sympathetic effect with increased heart rate, increased blood pressure, and increased cardiac output. Okay, it has a sympathetic effect increased heart rate, increased cardiac output, and the increased blood pressure. This makes ketamine useful in the shocked, unwell patient. It is used mainly for pediatric anesthesia, particularly when the repeated administration is required, such as for cereal burn dressing. Okay, ketamine has a minimal effect on the respiratory drive. Okay, and protective airway reflexes remains well preserved. Okay, this makes ketamine an ideal anesthesia drug to be used in the pre-hospital environment. Ketamine is also a bronchial smooth muscle relaxant and therefore has a special role in the management of several severe asthma. Okay, it causes the bronchial smooth muscle relaxation. Okay, so its use in the severe asthma is also a very special role. Okay, so what's the use? So ketamine has a unique combination of the cardiovascular effect. It causes the sympathetic effect like increased heart rate, increased blood pressure, and increase the cardiac output. So its use in shocked and unwell patient is very well. It is used mainly in the pediatric anesthesia, particularly when the repeated administration is required, like in the burns. breathing. Okay, ketamine has a minimal effect on the respiratory drive and protective airway reflexes. It protect the airway reflexes, remains well preserved. An ideal anesthetic drug to be used in the pre-hospital environment. Ketamine is also a bronchial smooth muscle relaxant, so it's very useful in the management of the severe asthma. Now, what is the contraindication? So, ketamine is contraindicated in acute porphyrias, head trauma, stroke, raised intracranial pressure, hypertension, and severe cardiac disease. Okay, it's contraindicated in the porphyria, then the head trauma, stroke, raised intracranial pressure, hypertension, and the severe cardiac disease. What's the side effect of the ketamine? There is a high incidence of extraneous muscle movement and post-operative nausea and vomiting. Other common side effects include the hypertension, tachycardia, and the transient psychotic effect. Okay.